Hi, I am Dr. Julie Brown, your Carrick trained concussion doctor, board certified chiropractic neurologist, and fellow in traumatic brain injury and rehabilitation. I am continuing down this road of digestion, and I'm going to break this video into upper GI and lower GI. And before I do that, we're going to talk about the autonomic system. When you are in a parasympathetic state, your body feels like it's not worried about danger or stress and is able to digest your food. That is a secondary need in life, as crazy as that may sound. I feel like it's a primary need for me, but we have our parasympathetic, P-A-R-A, rest, digest, awesome handwriting. And we would ideally like to be able to get into that state more often, but we live in a stress state, and stress is more of your sympathetic nervous system. When we are stressed, it creates an issue for the digestive system. So stress can be work, deadlines, relationship issues, stress driving in the car, environmental stress, whether it be from chemicals in the air in your house or food stress. There are many different ways that you can create stress on your system. Lack of sleep, all of those things create it. So when we have stress, we change the function of the enzymes in our mouth that begin to break down our food. So you can imagine if the chemical reactions that happen here are what stimulate the next set of chemical reactions, if this is screwed up, everything downstream is going to be screwed up. So we can do things like test for salivary IgA, which is into a tube, and testing your digestive enzymes. What does that mean? Does it mean that I help support those? And how do I do that? So it could be through stress reduction, it could be through diet. There are many reasons as to why that happens. But also in this process, we have our tonsils, which is a lymphatic tissue that's going to take some of that information and say, hey, we have good or bad things going on, and prep your immune system for anything bad that could be happening. We go down here in our stomach. Many people with heartburn, their stomach acid produces too late in the cycle, and they will get acid reflux. And we are concerned about acid reflux because it can lead to cancer, and I don't want to ignore that. But ideally, I want to understand why your stomach acid is not producing soon enough in your digestion. Yes, down the road, antacids may be appropriate, but I like to try to avoid everything before that, because then that means that antacid is going to stop the acid production and really make the rest of the cascade screwed up for absorption. We're going to continue on in the next video on the lower GI, and we'll go into more detail. Thanks.